Hello, my name is Dr. Ann Kane, and I'm a head and neck surgical oncologist. You are likely watching this video because you or a loved one are planning to undergo a total laryngectomy procedure. This informational video series was created to help walk you through the steps that will occur on your journey. This video series is designed to be in addition to the face-to-face discussions that you will have or have already had with your head and neck surgeons or speech-language pathologists. The following videos are meant to increase your understanding of this procedure and answer common questions about living life as a laryngectomy. My colleagues and I encourage you to look back through these sections as often as you need to throughout your journey.
What is a laryngectomy? A laryngectomy is a surgical procedure that involves removal of the voice box, or the larynx, commonly due to a diagnosis of cancer. The word larynx is the medical term that refers to the voice box, and your voice box contains three important structures: your vocal cords, your airway, and the muscles that are important for swallowing. This means that laryngectomy alters the three functions of talking, breathing, and swallowing permanently. There are two main pathways in your throat. One pathway leads directly to your stomach. It is known as the esophagus, or the food tube. The second pathway leads directly to your lungs and is called the trachea, or your windpipe. After a laryngectomy, the esophagus and trachea no longer share a common space. Separation of the airway, your mouth and nose, from the esophagus or your food tube will occur with the removal of your voice box. After your surgeons remove your voice box, we create a permanent stoma involving sewing your trachea to the skin of your neck. Breathing will now occur through this opening in your neck, and this means that you are now a permanent neck breather.
Let's take a look at these pictures to help you understand the anatomical changes to expect with this surgery. The image on the left shows how most would look before a laryngectomy. You can see the larynx, known as the voice box, and the vocal cords. Notice how the airway remains connected to the nose and the mouth. The image to the right shows what you or your loved one will look like after having a total laryngectomy. The main differences you will notice: there is no voice box, the airway and food tube are no longer connected, and the airway is now permanently altered to the outside of the neck. The patient is now a neck breather.
During the laryngectomy surgery, your surgeons will create a stoma for you to breathe through. A stoma is the area where the windpipe is sewn directly to the skin. It's the new opening in your neck that you will breathe through. This will be your only airway. This means that you are now a permanent neck breather. Air will no longer pass through your nose or your mouth. Because this is your only airway, it's very important to understand and take care of this new part of your body. A patient's stoma can get smaller or completely close if something is not placed inside it to keep it open. After surgery, your doctors will place a plastic tube inside your stoma to keep it open and allow you to breathe easily. This is called a Lary tube, that's short for laryngectomy tube. This can be removed for short periods of time to clean it, but it must be replaced back inside the stoma after cleaning. The body's reaction to any opening, like a cut, scrape, or incision, is to heal or try to close it. Remember, if your stoma closes, you will no longer be able to breathe. The laryngectomy tube will keep it open and prevent your stoma from closing. It's very important to understand that your stoma, the new opening in your neck, cannot ever close. If it closes, you will no longer be able to breathe. You are now a permanent neck breather, and this new opening is your only airway. Following your surgery, it's important to pay attention to the areas that are healing. Pay attention to your neck incisions and your stoma to see if there are any areas of drainage or increased swelling. Alert your doctor if you notice any changes in your tissue.
When you wake up from your surgery, you will have a flexible laryngectomy tube placed inside your stoma to keep it open and to ensure that you're able to breathe easily and comfortably. The Lary tube, also known as your laryngectomy tube, will prevent your stoma from closing. In the initial stages after your surgery, it's very important to remove your laryngectomy tube only for short periods of time while you are cleaning it. We do not want your airway to close or to heal shut. It is important to keep your Lary tube clean and free from clogged mucus. Clogged mucus in your Lary tube will result in difficulty breathing and can even lead to death. You will need to clean your Lary tube up to 4 times a day, more often after your surgery initially, and that is because you make more mucus at that time. Cleaning of your Lary tube is important to make sure it's remaining free and clean of mucus.
Losing your voice box means losing your ability to talk. This can be a very difficult concept to process, but our goal at UMMC is to provide you with education and support and to get you as functional as possible using a new voicing method. There are several options that exist for restoring speech after a total laryngectomy. The 2 main methods of communication that we will discuss today in detail are electrolarynx voicing and tracheoesophageal speech. An electrolarynx is a battery-operated voice box. It is a small, handheld device that creates vibrations. These vibrations act as your new vocal cords. By moving your tongue, your lips, and other muscles of the mouth, you will shape these vibrations into speech. Your speech-language pathologist will teach you how to use this device. The electrolarynx can be placed in the mouth with an oral adapter or on the face or the neck. Even though this voicing option is different than your current voice, our goal is to ensure that you have a way to communicate, even though you no longer have a voice box. With practice and patience, many become very functional with this type of voicing method. Tracheoesophageal speech occurs through the placement of a tracheoesophageal voice prosthesis, or a TEP for short. For this voicing method, the surgeons create a small puncture or connection between the wall of the esophagus, or the food tube, and the trachea, or the windpipe. The voice prosthesis, or TEP, is placed inside this puncture. The TEP is made of a one-way silicone valve. When a patient voices with the TEP, air is inhaled through the stoma, through the TEP, and into the esophagus, or the food tube, causing the esophageal tissue to vibrate. At this point, the tongue, the lips, and the other muscles of the mouth will shape those vibrations into speech. The vibrations from your esophagus, or food tube, are the source of your new TEP voice. A TEP can be placed at the time of the total laryngectomy surgery, or it can be completed at a later date as a secondary procedure. If you get a TEP placed during your primary surgery, you won't be able to use this voicing method right away. You must be completely healed and cleared by your surgeon first. Once you are cleared, your speech-language pathologist will teach you how to produce speech with your TEP. It's important to be aware that the TEP placed during surgery is not designed to last forever. You will have to routinely return to clinic to see your speech-language pathologist approximately every 3 months to have your TEP replaced. Your ability to manage the voice prosthesis and return to clinic regularly will be considered when determining candidacy for this procedure. Complications can arise from poor management of the TEP, and the TEP is something that you will have to clean daily in order for it to work correctly and be a safe voicing option for you. If you have a TEP placed, your speech-language pathologist will teach you how to clean, manage, and use your TEP.
Following a laryngectomy surgery, remember that the way that you breathe will change forever, Air will no longer pass through your nose or your mouth. Air will now pass in and out of your stoma in your neck. You will be considered a neck breather. In the hospital, an HME filter cassette will be placed on your laryngectomy tube after your surgery. This is a heat and moisture exchanger, or in simpler terms, a filter that will help condition and moisturize the air that you breathe. The trapped moisture from your exhale will allow your very next inhale to take the moisturized air down into your lungs. These HME filters will act as your new nose. It's very, very important that you always wear these HME filter cassettes day and night on your laryngectomy tube. This will decrease coughing and mucus production in your lungs. It is always important to keep your stoma clean and moist. This is so you can breathe easily through your stoma. Crusting or dried mucus in and around your stoma can cause extreme difficulty breathing, and this can present as noisy breathing, difficulty getting air in or out, or feeling short of breath. It is important to immediately let your healthcare provider know if you're having difficulty breathing from increased secretions or mucus. If you can't remove the crusting or dried mucus causing your shortness of breath, you will need to see your healthcare professional or go to the emergency room. Unfortunately, increased mucus and coughing are the most common complaints that laryngectomies report after surgery, but you can do something about this. Patients who consistently keep their stoma clean and moist by wearing their HME filters around the clock have approximately 50% less mucus than those who don't wear them daily.
Immediately after your surgery, you will not be able to eat or drink anything by mouth. A feeding tube will be placed either through the nose, called a Dopphoff tube, or through the belly, called a PEG tube. The type of feeding tube that you have will be discussed with you before surgery. It is very important not to eat or drink anything at all until you are cleared by your surgeon. You will be scheduled to take an X-ray test called an esophagram after being discharged from the hospital. This test makes sure all the tissues in your neck and your throat have healed adequately enough to withstand the pressure required to swallow safely. Swallowing is a very high pressure activity. If you swallow before you are ready, it can cause significant complications with your healing and delay your ability to begin swallowing in a timely manner. After you pass this test, you'll be given strict instructions on which items you are allowed to start swallowing. Again, it is very important not to eat or drink anything by mouth until you are told that it is safe to do so. A total laryngectomy procedure involves removal of several muscles important to swallowing. After this surgery, the way that you swallow will change. Due to surgical changes, your esophagus or your food tube and trachea or windpipe will no longer share that connected space. This means that you can no longer aspirate or have food or liquid enter the airway. This often makes swallowing easier for patients. Once patients are fully healed from surgery, many are able to consume soft to regular textured food items. Almost all patients will have some element of difficulty with meats and breads, as these textures are more difficult to swallow. Some patients may continue to have swallowing complications due to narrowing within the esophagus or other tissue changes. Your speech-language pathologist will teach you swallowing strategies to make your swallow function as efficient as possible.
After this surgery, air will no longer be passing through your mouth or your nose. This will change and decrease your ability to smell and taste. However, some laryngectomies do learn ways to swallow air and feel like they have a similar sense of smell and taste after surgery. Since your sense of smell will change, you'll need to make sure that you have working smoke alarms and keep regular hygiene. You'll also need to be careful when cooking or dealing with anything involving fumes, as you may not be able to smell smoke as easily as you did before surgery. Swimming and boating are extremely dangerous for laryngectomies. Your stoma does not close, and that means you're at high risk for drowning if you accidentally fall in the water. Any liquid that goes into your stoma goes directly into your lungs, and so it doesn't take much for you to drown. Additionally, taking baths can also be a risk in the case of an accidental slip or fall, so showers are really going to be the safest means of keeping regular hygiene. While you're in the hospital, you'll receive a shower guard that will protect your stoma and keep the water out of it when you shower.
Don't give up. There's hope. It does get better. You're stronger than you think you are. This is tough, but you are tougher. And it's not as bad as you think. You are not alone. You can do this. And you're in great hands. You're going to make it through this. Oh, you can do all the things. There's light at the end of the tunnel.
This surgery involves a huge life change for all patients. However, the long-term outlook is encouraging for many. Our primary goal of this procedure is to get rid of the cancer in your throat, and our secondary goal is to give you as much functionality as possible after the surgery. Following this procedure, it's important to have patience and give your body time to recover and heal. Occasionally, it can be very frustrating, discouraging, and difficult in the beginning stages, but many of our patients go back to work, coach, volunteer, talk on the phone, and live very functional lives after the surgery. Making sure that you understand your surgical recovery, take good care of yourself, follow post-operative instructions, and ask for help when needed are keys to helping this life change go smoothly for you.
The following websites are great resources for patients and families if you are looking for more information and support on what to expect after a laryngectomy.